Astron Hospital and Healthcare Consultants Private Limited has been established with an idea of providing comprehensive healthcare consultancy services in the healthcare industry, which was a long felt need because most of the consulting services available, they either talk of hospital planning or they talk of accreditation or some other fields. We attempted to provide everything under one roof: the hospital and medical college, other institutions planning, the quality, accreditation, public health, academics, all that could be done for any healthcare organization, we do provide under one roof. That probably is the hallmark of Astron. Our planning and accreditation has been based upon the evidence-based hospital design, which is the present day scenario coming up globally in the field of hospital planning. What we try to do is that everything that starts in the healthcare quality has to start at the drawing board stage. With that in mind, we try to make sure that all our hospital designs, they meet the requirements of standards, the national and the international standards, whether asked for NABH, JCI or any other regulatory bodies. They also meet the requirements and the guidelines which are formulated for various specialized areas. For example, the ASHRAE norms for the air quality, the international norms like HTM for the medical gas lines and modular operation theaters, or whatever be the criteria, the global and the national guidelines are kept in mind while planning of these institutions. Right from the time we start designing till we complete, the standards are met at every stage, so that ultimately when the institution goes into operations, they don't have to look back that we probably could have done better because at some time we missed on the compliance to the standards. We are also very strong in the field of accreditation and quality. Having been part of the formative years of quality movement in the country, I can definitely take that a pioneering role was played by us in establishing standards for the country and also making sure that these standards are put together in the organizations. We do provide consulting in the field of NABH, NABL, JCI, and have been privileged to be called by many of the prominent institutions in the country to provide those services to them. Till date, more than 300 organizations have availed of our services, and we can say with a lot of humbleness that there has been a very, very high satisfaction rate to the services that we have provided to them, and a large number of them having got the accreditations and re-accreditations wherever required. What we take pride in providing the services also in the field of public health, along with that, the research, academics, upskilling, which all goes into make the institutions what they are supposed to be in the terms of excellence. The aim is to look for excellence in the provision of services, and that's what we are known for. We believe in excellence, we provide the same, and that has been adequately proved by our contribution, where we have worked with more than 50 organizations towards the planning and establishment from concept to commissioning. More than 300 institutions where we have been the partners in providing them support for their accreditation movement. And we can say with pride that the services that we have provided are credible, ethical, contemporary, and have been provided with integrity. At Astron, we believe that we look for our mission and vision of taking healthcare quality to astronomical heights. In fact, where healthcare meets quality, Astron is there to provide the services for the same.
Group Astron has been established with a passion for excellence in quality and credibility in the healthcare industry. And this ethos has been our guiding force from the last so many years. Now we have set up benchmarks in the public health standards in the country, and our services have been spread over a wide range on our canvas, ranging from safe motherhood practices, from immunization, from community health, from communicable diseases, non-communicable diseases, and leading on to sexually transmitted diseases and HIVs also. And we have also been privileged to work with major healthcare industry players and the stakeholders in the market, right from public and the private sector and international NGOs. Our stakeholders mainly have been Government of India, various state governments, UNICEF, USAID, DFID. We have been working also with the WHO and also with major corporate players in the market. Astron strives to remain an important contributor to raise the public health standards both nationally and internationally. The Astron Institute of Social Sciences, an academic vertical of the Astron Group, is working towards skill development. The biggest bottleneck right now in the healthcare industry is the deficiency of the paramedical forces within the healthcare industry. And even though there are many institutes in the national level, but the problem is they are only trained on the classrooms. They are just theoretical people who are coming out of these institutes, and there are hardly any people who are actually skilled to come and start the work in the hospitals right away as they are out of the hospitals. And also but the demand is very, very high. Why? Because there is a rapid advancement of technology within the healthcare industries, and only because of these two problems there is a wide gap between the supply and the demand of these paramedical forces within the healthcare sector. Looking at this gap, so Astron Institute of Social Sciences has started courses for paramedical technicians, which are designed with a hybrid pedagogy, wherein majority of our focus is on bringing out the skills and training the people actually on the modern healthcare facilities within the hospitals. There is a less focus on the classroom training, but there is more focus on actually building up the skills of these people. Our endeavor has been to work on quality and not on quantity. We do not believe that we are going to bring these many numbers of people within the healthcare industry. No, but whatever students or whatever technicians we are trying to bring out are those who are actually quality conscious, and there is a lot of quality factors which have been inbuilt into it. And our endeavor here is that we bring out a high level technical human resource within the market. ASS is the academic vertical of the Astron Group and has been working towards skill development. Now, the biggest problem in the healthcare industry is the lack of availability of trained human resource to work in the paramedical sector. More so, with the rapid advancement of technology in the healthcare industry, our endeavor is to train the healthcare providers who actually get a feel of what they have to do in the healthcare market, within the departments, how they have to work. They get adequate exposure of all the machines and the techniques and the procedures which they have to adopt. And for ensuring this, we have come up with hybrid courses. And our pedagogy has been arranged in such a manner that we have basic classroom teaching of the students, and along with that we have maximum time of these people are utilized in actual working and in the practical sessions within the hospitals and actually on the machines where they have to later work as the technicians. Also, we are trying to develop a roster in a way so that while in the student days also they are able to actually simulate what they are actually going to do as when they become regular technicians. Our endeavor is to work on quality and not on quantity, that we produce numbers but their quality is not good. And now with all these things in our mind, we are now stable and we are actually trying to expand within the national level, and also we are going to expand beyond the borders.
Astron is trying to take forward the legacy of excellence established by Dr. Y.P. Bhatia and Dr. Neeru Bhatia in true spirit. Focus will be on regional and global expansion and diversification, while taking hospital planning and accreditation to newer heights in line with the global demands. We strive to create differentiation in skill development, paramedical courses, and medical placements. While we expand, due care will be taken to ensure that the benchmarks set in by Astron in the healthcare industry is raised higher and higher, so that we continue to perform excellence in healthcare services for which we are known for.
At Astron, we feel that the strategy and planning is a continuous process of business development. Our endeavor is to develop a thought process which aims at the development of a strong strategy in order to give the new heights to the business of Astron. We continuously involved in maintaining a strong strategic plan towards the corporate structure so that the quality assurance is to be maintained.
Hi, this is Lalita. I am HR and Administration Head of the Astron Group. We in Astron believe that every employee is the asset of the organization, unlike other physical assets, will gain value in time given the organizational support and environment. In spite of corporate, we have tried to maintain a congenial environment in our organization, and because of all this, we are able to maintain a high rate of retention of workforce. We are having employees who are working with us since incorporation. We conduct training, technical training, behavioral training, and management trainings and activities and welfare schemes of our employees to increase their effectiveness and efficiency in the work for their 100% of output. We are conducting their regular sessions, one-to-one sessions on regular basis or whenever it requires to counsel them for their personal skill and development. As we are in healthcare, planning and organizing, designing of the hospitals, so our focus is also to provide quality manpower to the hospitals and medical institutions we are associated with. Our endeavor is to provide a bright future to our employees.